All right, I'm from the red team, and I'll answer that question first.
Occasions like this, where we can sit down and learn what patients have said, and then try to see what we as providers can do to make some changes, are really, really important. And I feel like the more conversations we can have like this, the better we're going to be able to do for our patients.
This is such a great opportunity, I think, is really important for any hemostasis providers to collaborate and talk about issues related to patients who have rare bleeding disorders, especially what I would argue is our most challenging patient population, those with mild bleeding disorders.
Talking about this conversation and what is the opportunity to enhance care.
Also never seen anything like this before. I mean, I'm sure this has existed in other spaces somewhere, but it hasn't really been in the space that I've been in.
I think we were especially appreciative of the videos we saw from the patients' perspectives.
I think networking and hearing what other patients and other people's challenges are opened my eyes to things that are out there, to listen to how other people have overcome their problems so that I may be able to implement some of these solutions myself for my patients.
2 decades ago.
It was really good to hear people's experiences, their optimism, and to accept the difficult journeys that many women have had.
I think us sharing this information is so important to ensure that our patients get the best care that they need.
Especially in older patients who are milds, because they have a lifetime of not knowing.
It's been very encouraging that there's been kind of a confluence of enthusiasm, one about the importance of the problem and about the existence right now of better tools to diagnose and to manage mild bleeding disorders, and really like a shared energy to tackle this together.
That we reduce the amount of confusion that parents see.
And the more we think about it, the better we are going to be able to provide the care that our patients need. So I think these are opportunities that I look forward to be able to learn and share my experiences so that we can all do better for our patients.
I think us all talking to each other is the answer. So these starts are really important.
To get together with other experts and talk about the ways to really optimize treatment for our patients.
That isn't something that's in my space, and I didn't even realize until recently is a thing.
I really think is essential to making sure that we not only try to standardize our practices as best as possible, but also to just always be providing the best possible care for our patients.
Presentations and discussions, it seems like there's much more consensus in the room.
I hope it's the beginning of new relationships, because I think this needs to go together as community provider research partnerships, or else we're not going to figure this out. So I think this is the beginning of that. I think so.
And we are putting together our heads to develop an armamentarium of diagnostic and treatment tools, which may not be perfect, but working together, we will incrementally improve the problem and make life better.
I just feel really thankful, and I mostly feel really thankful. And I feel like there's a lot more to do.
And so I think that is a huge challenge from a hematologist perspective.
I think this is an amazing experience to be able to network with providers that actually do this for a living and are passionate about the patients that they take care
of having the importance of getting treatment plans for them and doing cord blood testing on their daughters as well whenever possible.
There's a very solid and wide base of people in hematology who accept, understand, and recognize this issue and are here to deal.
The conversation that we had in the afternoon, there were some recurring themes of trying to get data.
Our focus groups had 2 tasks today. One was when should we diagnose, and the other one was how should we treat them once we establish that diagnosis.
And then bringing this group together and seeing what providers perceive of that, and I can't wait to see what comes next. I mean, it's just been great.
It has to be something iterative, and there has to be some sort of structure for them to react.
And I think now we have a chance to make a dent for all patients across the board, and I hope that we can do that.
And we have a lab, so I'm going to ask them if what would this look like